some weird assumption, but then it turns out to be still within the framework of the task, and I will take a sigh of relief. So today you decided to work on your task 1 report, right? Very good. Welcome to IELTS Juice. Let's start assessing a report together. The chart below shows information about wages for healthcare professionals in 4 different countries. So we're going to talk about salaries. And for healthcare professionals like doctors, nurses, assistants, interns, I don't know, all those lovely people that help us stay safe, stay healthy. Now, of course, the second part is always a fixed statement, so I'm not going to read that. What I understand from this is that it's just limited to 4 countries, and probably a lot of money is involved, so words about money or numbers about money. So let's look at the visual, and yes, it's a table, and average monthly salaries for qualified healthcare professionals. We have 4 countries. Countries are labeled as A, B, C, D. Not very not very interesting, but yeah, not a very genius idea, but still. We have some asterisks here, and I need to read. The first, the one with 1 star or asterisk says source countries. These are the countries that supply healthcare professionals to other countries. So these 2 will provide others with the healthcare, and the ones with double asterisks, they're destination countries. They're on the receiving end. They receive healthcare professionals from abroad. Okay. Okay, so we have 2 types, generally 2 types of countries, those who provide or supply, and the others who receive or demand. And we have nurses and doctors and their salaries, monthly salaries, of course, yes. And whoa, what a difference. Oh my God. Okay. I don't see any year. And that means, yes, now that you have watched some of our YouTube videos, you should guess already by now that we are going to use present simple tense in our response. So let's dive in and check the response here. The given table represents average salaries per month. That's very good. For 2 occupations in the healthcare sector. Those are doctors and nurses. Very well written. It's very good. The sample data distributed across 4 countries. Pardon? The sample data is distributed across 4 countries. Or the sample data are distributed across 4 countries. That's a good introduction. But I don't see any significant points. The information given to us is very limited. You see, if you look at the table, we have only how many? 3 columns and 4 rows, and some footnote information. That's not a lot to go about, but at the same time, I still can come up with some significant points. For example, the doctor's salary in 4 countries is higher than nurses, and it is it's about twice the nurses, but not always. Another thing, you can say that generally speaking, the countries that receive healthcare pay a lot for their doctors versus the countries that provide the healthcare professionals. Obviously, okay, that's a very rough beginning. Obviously, source countries offer no payment amounts for both careers. Okay, that's correct. Country A seems to be the poorest because nurses and doctors only earn $32 and 40 or and 60. I need and $64 per month, respectively. This comma is not necessary. So it's the poorest. You get that assumption based on that. It might be correct, but I don't see an indication that country A is a poor country here. It's a risky move. I know you might say, yeah, if the country was rich, it would have provided or it would provide better facilities for their nurses and doctors, and they would get better pays. I know, but a country being rich or poor is not determined just by the wages doctors and nurses receive. I'm a bit skeptical. I believe this is a risky move. I cannot say this is wrong, but I would like you guys to reconsider. My philosophy in task 1 report is that whatever you see, report it, put it in words. If you cannot see that, avoid coming up with assumptions, speculations. You don't want to guess in task 1 reports. Okay, that's key. Whereas country B, at the same time, there's no time. At the same time, they can get, I don't need they, country B can get approximately 10 times more. Oh, they it is different from country B. Oh, they means nurses and doctors. Okay, referencing is not 100%. I would have used the whereas with the previous sentence, and I just put a comma here instead of period. Whereas country B, at the same time, is still troubling me. They can, one comma, they can get approximately 10 times more. In country B, they can get 10 times more, can they? 10 times more, 10 times more, yeah. That's correct. Nevertheless, these wages are still far away from destination nations. Correct. Correct again. I mean, you know, I feel the stress. When I read the sentence, I feel I'm going to make some weird assumption, but then it turns out to be still within the framework of the task, and I will take a sigh of relief. Okay, let's continue. In countries C and D. Okay, this is good. Why didn't we have this in the first paragraph? Like, let's focus on the supply part. Let's focus on countries A and B. In countries A and B, these things happen, and then you carry on with the rest of the sentence, with the rest of the paragraph. This is actually a good practice. We have one paragraph for countries A and B, and there's another paragraph for countries C and D. That's good. You can structure it in any way you want. You can devote one paragraph about nurses and one paragraph about doctors. This is logical. I like the way paragraphing is ordered here. In countries C and D, which have been defined as destination, which are defined, I don't need present perfect. Everything present simple. That's it. Which are defined as a destination, as destinations, because it's not a destination. There are destinations for health for healthcare immigrant workers, wages jump up significantly. The word jump would have been a nice fit if we had actually been provided with some history, as that it was this and then it jumped. Maybe we are comparing countries C and D with countries A and B. I wouldn't still use jump. Jump has this action intrinsically into the word. I would have changed it to something like there is a significant difference. The word difference doesn't necessarily mean that you had something and now you have something else. It's just a different section. It's just a difference, and it's static. Nurses in country C can get paid $2,900 monthly. The symbol of dollar comes before that. There's a simple lesson about how to write numbers related to price. I mean money numbers. And it's best that you take a look at it. Again, it's a very short lesson, 1 or 2 minutes. You can just go ahead and read it. I'll put the lesson in the description below for you to later read and improve your writing. Monthly, but again, same issue. The symbol comes at the beginning. But $500 more in country D. Why is it but $500 more? It's not but, it's nothing bad. I mean, you get paid 2,900 and in country D you get paid 3,400, right? 3,420. So it's like $520 more in country D. Besides that, doctors have the highest salary levels. I'm not sure, can be as 2 times more than nurses. I'm not, there's something missing. I mean, salaries, then I need a semicolon here. Their levels can be as high as 2 times nurses in country C, not in C, country C. But it's 3 times in country D. There's no need to say but. It's not a contradiction. And it is not it's. It is 3 times in country D, which is considered the lucrative chances for them. Who says so? It's a lucrative chance for them? I mean, please do not express your opinion. This is not good. We are not allowed to express our opinions in task 1. Generally, countries that train skilled human resources for medical service providers are poor payers. Okay, yeah, they're poor payers. They're Scrooge. They're, you know, very stingy. They don't give money to their doctors and nurses. Unlike destination countries that receive professionals and reward them generously. This is good. This is good. 171 words. Now let's look at the band descriptors. Okay. What do we have here? Task achievement addresses the requirements of the task, yes. And adequately highlights key features, yes. The information is appropriately selected, correct. Why isn't it not 7? I told you there are elements that the task needed to present to us, that it is it's not just reporting, it compares data, it summarizes the data accurately. It doesn't give you speculations, guesses, and it doesn't give you, it tries to give you the most accurate information. The organization of the report is good, it's logical. I understood the logic. The logic was we have 2 countries as providers when we have, so we need 1 paragraph for that, and we have 2 other countries as receivers, and we need a paragraph for that. So the logic was there. The progression was clear. There were some faulty transitions that I didn't like why but was used in a sentence that wasn't actually contradicting the two parts, the parts before and after itself. And it happened twice. And the referencing again was not very clear. Vocabulary was fine. I was able to understand with some errors, I mean, here and there, but the errors were more in grammatical range and accuracy. I mean, I had more issues with grammar than with vocabulary. And yeah, if you miss a verb, if you connect your sentence with another sentence and it's not clear whether it should be a full stop or a period, or you have missing connectors there, then yeah, you're reducing the communication. Is this a 6? I would say it's a rather generous 6. This, you know why? In fact, some of my colleagues might look at it and say, no, this is, I will consider that a factual mistake. I will consider this both a grammar error and vocabulary mistake. And this can go down to 5.5. I feel it doesn't even deserve the 6. But we just read it, we understood the report, and I'm happy with the whole structure. I'm happy with the selection, and I just need to tell you, this is not easy when your visual gives you very limited information. To see a very good option on what to do when such cases come up, take a look at the sample. I'll put the link to a 7+ sample of the same topic in the description below. Check it on the IELTS Juice website. All in all, I hope you learned or you had some takeaways from this report. Remember, your reports are going to be your representatives. Your essays will also be your representatives. But in case of reports, remember that you are going to report whatever you see. So avoid using your personal opinion or give any or avoid giving any suggestions or speculations. On that note, I wish you a lovely day ahead.